Dizziness is an extremely common disorder that afflicts an estimated 10 to 20% of individuals older than 70 years old. Even for those younger, dizziness is a not uncommon problem. Several studies have been performed over the years to try and quantitate what are the most common causes of dizziness to help narrow the possibilities, given the workup for dizziness can be long, tedious, and time-consuming. Here are the top 12 causes of dizziness, not in any particular order. BPPV, or benign paroxysmal positional vertigo, is a condition described as sudden bouts of spinning attacks triggered by movement typically lasting no more than 15 minutes. BPPV can be treated with specific exercises such as the Epley maneuver. Anxiety is fairly self-explanatory. Usually the dizziness is described as lightheaded imbalance that lasts hours to days. Orthostatic hypotension is usually described as lightheadedness, such as the vision going dark when severe, when going from a laying to standing position. Correcting the low blood pressure resolves this particular dizziness. Similar to hypotension, cardiac arrhythmias as well as vascular obstructions like carotid stenosis trigger imbalance due to impeding adequate blood flow to the brain. Inflammation or viral infection of the inner ear balance system called the labyrinth can certainly cause dizziness as well. Typically no pain is present, but the dizziness is unrelenting for days even when remaining still. If a person suffers from recurrent vertigo along with fluctuating hearing loss, along with tinnitus and earfulness in 1 year that precedes a dizzy spell that lasts hours to days, Meniere's disease may be present. Initial treatment is typically started with dietary restrictions, diuretics, and beta-histine. A pinched nerve of the cervical spine can also trigger sudden episodes of dizziness, especially with head movements. Concurrent posterior neck pain is also common, along with some pain, numbness, and/or tingling down the shoulder and arm. Brain tumors, either cancerous or non-cancerous, can cause dizziness, especially if it is pressing on the vestibular nerve. There is greater concern for this possibility if there is nerve hearing loss worse in 1 year compared to the other. If dizzy spells occur along with headaches with or without light and noise sensitivity, migraines may be the cause of a person's dizziness. This condition is specifically called vertiginous migraines. Treating the migraine will often resolve the dizziness. There are many medications that can cause dizziness as a side effect. Common medications that can cause dizziness include hypertension medications, benzodiazepines, neuromodulating drugs, narcotics, and blood thinners. For some patients, allergies can cause dizziness. The dizziness is typically continuous but relatively mild. Most patients are able to function without any limitations in spite of the dizziness, which most patients have a hard time describing given how vague it feels. Treatment is typically with antihistamine oral medications alone. Occasionally, a clogged ear due to Eustachian tube dysfunction triggers imbalance. The worse the ear clogging, the worse the balance. As such, treatment is to resolve the Eustachian tube dysfunction, which will then spontaneously resolve the dizziness.